All right, there you are. There you are. Perfect. How are you, Brien? You all
Yeah,
right?
good, good. Looking forward to this. Yeah.
Perfect. Same here, man. I'm excited to talk about this. Lots of people have been asking me. All right, so let's get started. Um, for the people on my stream who don't know who Brien Seeney is, please tell us, 1 or 2 minutes, who you are, what it is that you do, my man.
Yeah. So look, I'm a physiotherapist or a physical therapist. I know you guys call them in Australia. So I cover, I started, I guess my online persona is NRL Physio. NRL is the National Rugby League. So you guys hear a lot about rugby over in the States. There's rugby union and rugby league. Rugby league's probably the more, I guess, popular code of the sport in Australia. So I do injury analysis, similar to what you do, video analysis, education to fans about injuries in the NRL, and yeah, cover pretty much across that, just to sort of fill in that gap between what teams sort of provide to the public and what that actually means for fans.
Okay, very cool, very cool. So tell us now, let's get right into it, young man. And tell me, Brien, why such a love of rugby? Why?
Yeah, look, like as I said, it's like rugby league, I guess, is probably, you've got winter and summer sports. So over here, summer sports for us is cricket, which that's kind of what most Aussies played growing up. But then in the winter, you've got a few options. You've got soccer, you've got AFL, which is the Australian Football League, so a bit more kicking, that kind of thing. Or you've got rugby league, and I guess just where I grew up, rugby league was the sport. That was what you did. Did a bit of soccer, a bit of AFL too, because I'm love my sport, so played a lot of things. But rugby league was just the sport that I connected to the most, both as a player and as a fan. It's really, I live in Queensland in Australia, and certainly in those eastern states, Queensland, New South Wales, rugby league is almost the religion sometimes. So yeah, it just grew from there as a kid, and then as I grew up, obviously went into the physiotherapy sort of career, always wanting to work, with athletes and with sports people, and just moved towards the sports that I like as well, and that was rugby league.
Okay, now let me ask you a quick question, because I don't know that much about rugby, although I did have a son who played rugby. Okay, so rugby, Australian rules football, what's the difference?
Yeah, so I guess Australian rules football is a lot more centered around kicking. So to score points, to move the ball throughout the field, it's in terms that a lot of the American viewers will understand, it's a whole bunch of punters on the field. And a few of our Australian rules footballers have actually come over to the NFL. Ben Graham was one. He came over and became a punter in the NFL after his Australian rules football career. So a lot of kicking, a lot more endurance, that kind of thing, whereas your rugby, probably more towards your NFL side of things in terms of, heavy contact, tackling, running the ball, passing the ball between players, that kind of thing. So that's probably the two main differences. There is tackling and stuff in Australian rules football as well. But certainly the high contact nature of rugby sort of separates it a little bit, I'd say.
Okay. So tell me now, so you had an interest in rugby, okay? But how is it specifically that you became an injury analyst for the NRL?
Yeah, look, like I have to sort of give credit to the likes of yourself in that way, in that it'd probably be 5 or 6 years ago now, I really started to get into the NFL, particularly through fantasy sports, as a lot of people get engaged in. And so I asked a friend of mine, because the NFL games happen in the middle of the night over here, so it's really hard for us to sort of keep up with any of the news, the injuries, all that kind of stuff. I said, what should I do to more effectively do this? He said, join Twitter. Let's join Twitter. And so joined Twitter, and I joined Twitter not as NRL Physio to start with, just a random thing. And I just saw, sort of through following all the American sports, how much of an appetite and how valuable this information is. I mean, you would know, like, and before I started doing the analysis, you'd just be watching sport, you'd see someone go down and you'd think, oh, there's an ACL injury. Now, you and I think that because of the knowledge that we have, but for the vast majority of people, they don't really know, what it is. And you hear the commentators, the guys on the TV, speculating about it could be this, it could be that. I remember the first ever injury that I commented on was a clear patella dislocation in one of the games of the NRL. And the commentators, his season's over, he's blown out his ACL, all that kind of stuff. And so to be honest, it was the perfect sort of, I guess, launch pad for me, because I put up a video and said, clear patella dislocation, sort of outlined, the recovery kind of options and stuff like that. And everyone was sort of going, how do you know that? Like, they're saying it's an ACL on the coverage and stuff like that. And then, of course, it did come out that it was a patella dislocation, and just sort of went from there. So yeah, definitely have to give credit to the likes of yourself and the different analysts sort of over in the States, because that kind of opened my eyes to just how much, I guess, value that information that comes naturally to the likes of us. It's really valuable for fans.
For sure. And it's funny, like, as you mentioned, I spoke to Grayson Boucher, the professor, over the weekend, and I was telling him how I can't watch sports just for entertainment anymore. Like, I do watch it for entertainment, but like you said, I can't turn that off, right? And so you see somebody do something, and it's like, yep, ACL. Oh, yep, it's this. Oh, shoulder dislocation. And already you're thinking in your head, okay, what's he going to do for treatment? What's his rehab going to be like? How long is he going to be out? And so, it's very hard just to be entertained and to turn that off, right? So
absolutely agree.
And the one thing that I thought about as you were speaking, and I want to ask you about, so I'm a full-time orthopedic surgeon, and I own a business, and then I do all my YouTube and social media stuff on the side, and I know how busy I am. So you put out way more content in terms of, you don't necessarily do full videos, but you have way more content than I do, and you're putting out stuff all the time. And so I want to know, how much or what percentage of your time on a weekly basis do you think is dedicated to coverage of the NRL and injury analysis?
Yeah, well, look, like, I'm very similar to yourself in that, like, I have a full-time job. I own 2 practices, actually. So that takes up a massive, majority of my time. I've got a young daughter who's 15 months old, so family life is quite busy. If we had done this interview maybe 3 years ago, my answer would be a lot different, in that I used to spend a lot of time on it, especially weekends, which is when the sport tends, NRL games tend to be played. It used to be, like, I would say, you'd probably spend at least 5, 6, up to 10 hours over a weekend, sort of, watching games, going through injuries, that kind of thing. And then maybe a couple of hours during the week. I've definitely, as I've sort of gone along, I've refined the process a lot. So we have a wonderful service over in Australia called KO Sports, which is kind of like the Netflix of sports. So if there's any NRL game going on, and there's an injury, my phone starts, going off in my pocket. Everybody's sort of saying what's happened. And even if I'm not watching the game, I can pull my phone up, check out the injury within 2 seconds, bring up the app, check it out, take a screen recording, little analysis, and I can usually have it done within 5 or 10 minutes. And it's not as, I guess, time consuming as what it used to be, where I used to have to sit in front of the TV whenever a game was on and make sure I was watching it. So it's definitely come down a lot now. Being a young dad, or a dad to a young daughter, that priorities, have definitely changed compared to, when I didn't have those responsibilities. But yeah, look, I still love it. And I like, it's a great thing to spend your time doing. So whenever I do it, I really enjoy it.
For sure, man. And I love, while I do this myself, I love to look at stuff I follow your feed and I'm looking at the stuff you're posted, and I'm always like, okay, this is what Brien saw. Now I want to compare and see what I saw and see if it's different, definitely. See if it's the same, see if there's anything else that I can add. So I really dig the content, and I like, even though I don't necessarily follow the sport as a sport, I'm following the injuries and seeing what's going on. So I appreciate what you're doing because of that. So now you said that, so you have basically two practices that you are a part of. Are either of those practices associated with the NRL or NRL athletes?
So the NRL, hang on, there we go, we're back. Look, the NRL, I guess you would say, once again in your terms, is like the NFL. So when we talk about the NRL, it's the creme de la creme. It's the professional league, effectively. So me being just a musculoskeletal and sports private practice, I don't work with any NRL athletes, because once they get to those high levels, and those teams have their own medical staff, their own physios, all that kind of stuff. I definitely, where I sort of work with is rugby league athletes. So, I've got a couple of guys who are in the under 20s at the moment, working their way up through the ranks. You get guys sort of after they retire, that kind of thing. Just your general athletes of the general public, some at a very high level, others, your weekend warriors and your guys who just want to go out and have a bit of fun with sport. But yeah, no official sort of affiliation with the NRL and stuff like that, because once they get to that level, there's their own specific, specialized teams for those players.
For sure. So let's talk then about the actual injury analysis now. So just off the top of your head, what do you think, give me maybe the top 3 or the top 5. What are the most common injuries that you see as an injury analyst for the NRL?
Okay, yeah, look, like number one, musculoskeletal wise, is hamstring strains. That tends to, and I think that's across many sports, but yeah, certainly in the NRL, we find sort of hamstring strains are the most commonly occurring injuries. Like the other one, which I tend to analyze a bit less because, the uncertainty around it, but concussions are certainly a big thing lately because of the high impact nature of the sport, and also the growing awareness of those concussions as well. So certainly sort of, I guess if you went back 5 or 10 years, there wasn't as much awareness around concussions and stuff like that. Guys coming from the field for head injury assessments and different things. So concussions have certainly become a lot more. But then you have the nature of the tackles and the way that the tackles occur in the NRL, things like MCL sprains, syndesmosis injuries, those kind of things, because of the contact to the legs. We do tend to see quite a lot of those as well.
Okay. And so the injuries that you observe now, do you think that they are primarily a function of the sport itself, its rules, the surface that you're playing on, or a function of the athletes themselves? So what I mean by that is, each sport has a particular body type that's associated with it. And so do you think that the injury patterns that you see here are associated with any one of those fractures or factors, or maybe multiple of those fractures, some combination?
Yeah, absolutely. Yeah, look, I think definitely the nature of the sport and the rules of the sport play a significant role. So the high contact nature, you've got big guys. The contact that you see in a sport like the NFL, you've got high contact, but with no pads. There's no protection there for the guys, so they're running into each other. From 10 meters away, sprinting, colliding. Twisting legs, changing direction, all that kind of stuff. So definitely the nature of the sport plays a role. But certainly I think, and I talk about this a lot recently, in that the as you said, the physical build of the players is a significant factor as well. I say all the time, look, the players are getting bigger, faster and stronger. we've got guys who,
For
you know,
sure.
yeah, like you've got guys who play on the wing, which is the position sort of, I guess you call it the wide receivers in on the rugby field. They play right on the outer edge. And now you're looking at guys who are over, you know, in Australian terms, they're over 100 kilos, they're 6 foot tall, they're big dudes, you know, they're guys that back in the day, they would play in the middle of the field where a lot of the contact is, but now they're huge.
Mm-hmm.
Guys, you know, like if you went back 20, 30 years, these players who are playing on the wing, on the outer edges, they were my size, under 6 foot, tiny, quick, shifty guys. But unfortunately, those guys have kind of phased out of the game a little bit because, yeah, players are just getting bigger, faster, stronger. So injuries like the explosive injuries, like your ACLs, your Achilles, you know, the pec even, you know, those kind of things, they're happening more often these days because those players are, you know, the performance is improving. And that's another thing I talk about. With improved performance, you get, unfortunately, increased injury risk because you've got greater forces going through. You've got grippier boots, you know, that helps with performance. Guys can change direction, they can cut quicker, but that's going to put extra pressure on the knees and the ankles. So I think that changing sort of, and that's across all sports, obviously, but that changing sort of nature of performance and guys, you know, getting bigger and better, that I think that plays a role too.
For sure. And, you know, one of the things, so obviously in North America, with North American football, we, as you said, we have pads, and I've played it at a high level and I've coached it at a high level. And I've always talked to guys about hitting form, hitting technique, and how to be safe when they hit. And interestingly, we always say, well, you guys need to hit like the rugby players because they are guys who are going at each other full speed and they don't have equipment. But now, as you said, because everybody's so bigger, faster, stronger, even though they tackle with better form, different technique, it still doesn't matter because they are so powerful now that the whatever safety margin that you may have had because of their technique and how they were hitting each other is canceled out by the increased speed, the grippier surface, the bigger side, the more mass. So it's a, you know, it makes the game exciting because of bigger, faster, stronger.
That's
but
right. Yeah.
Also, it's a bit of a double-edged sword because, as you say, the margin for error is smaller and there are bigger risks that are associated with it. So
that's exactly right.
Now let
And
me
we
ask
found,
you.
yeah.
No, go ahead.
Sorry, you go. Yeah, well, we found this year, like even with, you know, different, all the COVID stuff, and you talk about the margin for error being so fine. This year, the number of significant injuries, so like I term them as sort of 5+ weeks, you know, required recovery, the number of significant major injuries this year shot through the roof. And it's just a sign that, you know, as you said, that margin for error, it only takes one small thing to go wrong. And because of the significant forces that are at play, it's not just a minor injury that occurs. It's significant damage.
Yes, and you know, just to add on to what you said there, you know, last year you looked at the NFL, and I think that there were upwards of high 40s to 50 ACL tears in the NFL the entire season, right? This year we have a shortened season, and in the first week, 7 ACL tears, and you know, you think these guys had all this time, they should be working out and all of this stuff, but you can see that clearly, just as you said with the rugby, that their bodies are not in the same shape that they normally would be. They are not as resilient as they normally would be, and the margin for error is very, very narrow, and they are, you know, the possibility of injury is very, very high, you know. So let me ask you about the NRL in particular, how they have addressed this, or if they have. So has the NRL implemented any policies that may help to prevent the most common injuries? And what I mean by that is example. So for example, like soccer, you have the FIFA 11, right? Or I can't remember what you guys call. You have one called the footy something or other. But have they implemented any kind of process or that may help to mitigate some of these injuries?
Yeah, look, I would say they probably don't have a specific program like the FIFA 11. And I know Rugby Union, they have like a Rugby Activate or Rugby Active or something like that they kind of, they have a specific program. But I'd say overall that focus on sports science, injury prevention, that kind of thing has definitely grown in the NRL over, the last 10 years or so. We're seeing guys, like, and a great way for me to sort of keep up with it is you see guys on social media, they're posting videos of them. They're going to, trampoline centers where they're working on landing, they're working on balance, that kind of thing. Last year, and you talk about ACL injuries and in terms of the incidents last year. So I tracked sort of the ACL injuries over the last 10 years, and last year was the lowest year in 10 years for ACL injury incidents in the NRL. And look, that can be luck, but look, at the end of the day, I think it's a result of the work that teams are putting in behind the scenes on those injury prevention measures to try and make sure that guys are, that guys are, not suffering those preventable injuries. Because at the end of the day, with a contact sport, you're gonna get injuries that you can't prevent, right? There's going to be, especially those contact nature injuries. There's just not much you can do a lot of the time, but certainly those preventables, and we know with the evidence that, like up to 60-70% of those ACL injuries, those non-contact ACL injuries, they can be prevented sometimes if we have the right training programs in place. Hamstring injuries, if we have an effective hamstring program in place, those hamstring injuries can be brought down as well. So there definitely is a pattern of those kind of injuries coming down. This year has been a bit of an anomaly. I think COVID sort of bringing that into perspective, similar to a lot of the sports over there. A lot of the NRL guys had to go from, being in isolation, being not training with the team. And then within 2-3 weeks, they were back playing full on NRL football. Which is, like that's always going to cause issues. And we've seen in sporting leagues across the world, and you said with the NFL, there's been that increase in injury. I mean, as I said, I keep up with the NFL. I play fantasy sports, and, like the number of people who've lost players, in the first couple of weeks of the NFL is quite significant. Yeah, that's right. And we've seen that in the NRL too. There's been a massive sort of increase in those injury numbers. And I think COVID, look, at the end of the day, COVID has affected so many, so many walks of life, and sport and injury, injury risk isn't going to be immune to that, unfortunately. I've seen it in my practice. I've seen, we had a certain time where community sport was shut down for a period of time. So people were sitting at home, you're doing their own thing, and then all of a sudden sport came back on, and everyone went like a bull at a gate, back in there 100 miles an hour trying to, get back in because they'd missed their sport. And it's just been injuries galore at the moment. And I think that's played a big role.
Okay, so now, just out of curiosity, so you're an analyst for the NRL. Do you do any analysis for any other sports?
Yeah, like, well, mainly on request, I would say, like, or if I find a particularly interesting injury, like I've done NFL injuries before, like Pat Mahomes was a big one last year when he dislocated his patella. That was one, fans who, like, I'm probably one of the only injury analysts in the Australian sort of sporting landscape. So when a big injury happens, I do get people coming to me, whether it be the NBA, the NFL, those kind of things, I do get quite a few questions. So look, as you know, while you have your sport that you like to follow and stuff like that, injuries don't discriminate. You know, an ACL injury in the NRL is going to look very similar to an ACL injury in the NFL or in the NBA or in European soccer or something like that. So I you know, people often say, I know this isn't your sport of expertise or something like that. And I'm like, well, I don't even really see myself as an expert in the NRL, really. I see myself as someone who has, you know, added insight into injuries as a whole. And I just tend to, you know, the NRL is my sport that I follow. So I tend to, you know, obviously keep up to date with a lot more of the injuries in that landscape. But yeah, across the board, you know, I love looking at the, you know, any sort of injuries that happen, interesting injuries that happen in different sports.
Cool. Okay, so now let's do a little comparison here now. So if you compare turf athletes in your general practice, okay, and then compare them to the professional NRL athletes that you analyze, what would you say about the injury profile? How does it compare when you look at those two groups? Are they similar or are they different?
There's definitely similarities. I think in the NRL, it's, as I said, it's that high impact, explosive nature of the sport that probably separates it. You know, if you look at guys who are playing soccer, who are playing Australian rules, and even to a degree playing rugby league, sort of at the, I guess, the sub-professional level, you know, the community level, that kind of thing. You probably don't as often see those explosive high impact injuries. Like this year, for example, there's been in the NRL, I know there's been, I think it's 15 syndesmosis repair surgeries that have been required to happen. Now, in my sort of last, I'd say 5 years of practice, I've maybe seen half a dozen. Yeah, and it's just that high impact nature, I think, that brings those explosive injuries into play. So I would say that's probably the big separation, is your sports like soccer, like AFL. While you do get those contact injuries and stuff like that, the NRL just sits at another level because of just the explosive traumatic nature of the collisions.
Okay. Now, let's talk about the experience or what you've learned from your analysis in the NRL. And then have you applied any of that to your own particular practice? And you said, you know, you're not covering NRL athletes, but has that shaped, you know, your own personal practice with your patients in any way?
Yeah. Look, like I say all the time, I think like we as physios have to do professional development every year. You know, that's a requirement of our practice, is continuing education, doing that kind of thing. And I often say that doing this NRL physio stuff has been more valuable than any sort of continuing education, because it not that I wasn't sort of reading up on papers or, you know, researching different injuries before, but now I just do it a whole lot more, because, you know, a star player for, you know, the premiership favourites might go down with a certain injury, and I'm like, I want to know everything about that injury. So if anybody asks me the weirdest, wackiest question, I've got the answer to it, you know, and so it's definitely opened my eyes to you know, a lot of different people in the social media sphere as well, sort of keeping up with different things. Specifically, I'd say the big thing that's changed for me is I'm certainly much more conservative and really thorough in sort of educating my athletes when it comes to returning from hamstring injuries. You know, like before that, I probably wasn't, you know, to be self-critical, I wasn't as diligent at, you know, making sure guys knew that, you know, you had to make sure you ticked all those boxes. It wasn't a matter of, oh yeah, I'm feeling good, so away I go. Let's go and return from that grade 2 hamstring strain that I have. The recurrence rate is just too high to be doing that. So yeah, I really make sure that I'm sitting down with my athletes and emphasizing and running through the stats and being like, look, this is your risk. If you don't rehab it correctly, this is what you're up against in terms of re-injury rates and stuff like that. So, yeah, I'd say my approach to hamstring injuries definitely has changed, because just seeing how it, plays out even at the highest level. Like, we're talking about guys who are, they're under the care of the best medical teams in the country, and the recurrence rate is still huge. So if they're sort of looking at it from that perspective, then we at the private practice community level, we have to be on top of it as well, I think.
For sure. And it's funny, when you talk about when you talk about how it's shaped your practice, I think about telling patients all the time that feeling good and being better are not synonymous, right? And so often you have people, they've had an injury, they've put in some work, done some rehab, they feel good, right? And they go, I'm good, I'm going to go back, right? But you can see the atrophy when you compare one side to the other. You do some tests, they are not the same. And one of the things actually that I'm going to give a shout out to one of your countrymen there, Mick Hughes. I found the Melbourne ACL rehabilitation guide. I had used one before. I trained at Fowler Kennedy in Canada, and so I used their rehab guide. And then I stumbled upon Mick's, and I started using that, and I love it. And the reason why I love it is this. It doesn't matter how you feel. It doesn't matter the time from your ACL injury. This is numbers, okay? Do the test, okay? You feel good? No problem, brother. Do the test. Do the test. The numbers don't lie.
That's right.
And you
prove it to me.
Exactly. Prove it to me, right? And then it's like not me telling people you're not ready. It's the numbers, right? And the test has done it. You didn't pass the test, and there you go. So you have more work to do. And the one thing that I've said to Mick about this is that, because I think on when you do the testing criteria, you have to score within 90 to 95% of the other side. And the one thing I said to Mick is this. I said, look at Mick, when they injured themselves, we'll assume they were 100% on that side, and yet they injured themselves. So personally, I don't think we should be doing 90 to 95%. I think you should be 100% or more compared to the other side. That should be our rehabilitative standard, because they got injured when they were 100%, right? So if we're trying to get them back to a level where they are as good as or better than what they were before, we want to minimize their risk and bring it down as close to zero as possible, then that's my own personal thing. And, I use it in our facility. My physiotherapists use it with my ACL patients. And we still I've made them bump it up to 95. But I have talked about going to 100 or 105, 110%, because I just think they were injured before when they were at 100%.
Absolutely. No, look, I'll second exactly what you say. Like Mick, I use his ACL program exclusively, and it's been fantastic. So anybody who's watching out there who wants a guide, is struggling with their ACL patients, or not even struggling, just wants to further their effectiveness at returning athletes, like having that guide and those numbers. As you said, I print it out with every patient who I get who comes in with an ACL injury. They get a print out of that program straight away, so they know this is what we're doing. Okay, you don't, it's not, I'm 9 months post injury, sweet, I'm ready to go back. Let's have a look at that program. Where are you? What boxes are you ticking? And then they've got a real clear goal, and it gives them something to work towards, which I think is fantastic.
All right, so let's just talk about Brien Seeney for a second, okay? So tell me, what is the average day for you? Not an NRL analysis day, but just what is the average day for Brien Seeney?
Yep. So look, I'd say the average day, I'm usually 7:30 till 6:30. That's kind of my big day. I have 3 or 4 of those a week. Probably I might see between 18 and 20 patients in that day, depending on how busy the day is. And across the week, I have 3 or 4 big days, 2 half days where I get to, do, like, as I said, being a partner in the business, sort of keeping on top of those day-to-day things, HR, all that kind of stuff, which is always fun. But yeah, just dealing with, and we deal with at my clinic, like obviously your sporting injuries. So that can be from, as I said before, your weekend warriors, guys who just, want to go for a 5K run on the weekend, all the way up to, people who are looking to, aspiring to the Commonwealth Games, or, as I said, I've got a few guys at the moment. I've got one guy who's working through an ACL, he's hoping to make the NRL in the next couple of years. So it's guys across the spectrum. I also have just general musculoskeletal injuries as well. So I'd say it's probably about a 50% split between athletes and just general population. But yeah, it really, it keeps me busy and I enjoy it, and I like the variety too, which is good.
Okay. Now, 2 questions back to back. The first question is, in general, just, in a nutshell, give me what your treatment philosophy is when you're treating patients. Okay. So that's part 1. And then part 2 is, do you alter that treatment philosophy when you're training your high-level athletes versus Joe Blow, weekend warrior, or other people?
Yep. So look, I'd say my overall treatment philosophy, very, very simple: get people moving. I think that at the end of the day, that is so important. I think certainly in my career, that's where, I guess probably at the start, I just was coming across people who are like, oh, I'm injured, I've got to protect it, like I've got to sit down, put my leg up, like I don't want to do anything because my back's sore. I don't want to do anything because I've rolled my ankle, that kind of thing. And that was probably where that really drove me. I was like, no, we need to get you guys moving. We need to stay active, make sure that we're rehabilitating whatever the injury be, effectively. You talk, like, there's a lot of discussions obviously about, exercise versus passive modalities and different things. I do use your passive modalities, but that's always with a view and with educating the patient towards the reason we are doing this is to get you moving. That is the goal of everything that we do. We are either moving or we are doing things to promote whether it be their motivation or their feeling towards getting moving. That's the most important thing. Now, in terms of your regular Joe Blows versus the high level athletes, I think the getting people moving is so much more important for the regular, community based patient, because there's so many injuries that you see from that demographic are people who don't move enough. It's people who aren't getting up and, going for a, 30 to 40 minute walk during the day. They might have, stiffness, restriction, all that kind of stuff. And they think they come in and they're like, oh, I just need you to massage this to loosen it up or whatever. And, sitting down and speaking to them and being like, look, I'm sure that might make you feel better for half an hour, but this is something that moving forward, we need to make sure that you're moving those areas to make sure that it doesn't come back again. So I would say, that's probably the biggest difference is with those community-based patients, your regular mums and dads and different things. I definitely have to sort of sit down and give that advice and education about how important movement is and how important exercise is for, different pains, and especially when there's not necessarily a significant traumatic mechanism of injury there. With a lot of the athletes, and I'm sure you would know this too, you talk about load management and different things. sometimes you have to put the brakes on them. They want to move too much. They want to keep going. They want to, I might see a marathon runner who just wants to keep running, 100 kilometers a week. And you can't do that if you've got an Achilles tendinopathy, or something like that. We need to back you back and load that up appropriately. So you don't tend to get that as much with your community-based, general day-to-day injuries, where you have to kind of put the brakes on, because usually it's we've got to pump you up and get you moving. But yeah, I'd say that's probably the main differences.
Okay, excellent. So let's talk about a little bit about preparation, okay? And do you think, we'll talk about the NRL athletes and then also other patients afterwards, but do you think that prehabilitation or, mobility work, that kind of stuff, can help to prevent injury? Like, obviously both of our jobs are in the business of helping people with injuries. But definitely. Do you think, and we touched upon this a little bit before talking about some of the programs for rugby, but do you think that prehabilitation, mobility training can help to prevent injury, first in the NRL, and then just with general population patients?
Oh, look, I think for both, absolutely. I think that's probably, apart from, in my role as NRL Physio and doing that injury analysis, apart from sort of analysing injuries and letting people know sort of the expectations for recovery and stuff like that, I also sort of pride myself on my role, raising awareness to the general population about how hard these guys need to work behind the scenes to make sure that those injury numbers that you see come out every week aren't even higher. And I think it's so important that prehabilitation, we have in Australia, we have a warm-up sort of that the guys go through out on the field, which I know that they do in the NFL as well. And every now and then there'll be an injury suffered during that warm-up. And then you get all the pundits coming in saying, oh, why do they do a warm-up? We never used to warm up back in the day, and we never suffered an injury before the game. And I say, well, you might not have suffered an injury before the game, but I can tell you would have suffered way more during the game by not warming up, by not doing those things that you needed to do, that little bit of prehab to make sure that you're ready for that game. So yeah, I do definitely pride myself on sort of raising awareness to the fans and just the general population about how they don't just walk into the sheds, put their kit on, and away they go, and they don't just go to training and pass the ball around a couple of times. They need to do that prehab to make sure that there might be 100 hamstring injuries happen in the NRL this year, but I can guarantee you there'd be 200 or 300 if they weren't, doing that prehab. And yeah, as you said, part B, in terms of my regular patients, it's exactly the same thing. I always say to people, particularly with athletes, I'm like, look, if you want to take your sport seriously, you need to take looking after your body seriously too. You can't have one without the other. You can't just expect to be really committed to your chosen sport and not do the extra work and not look after your body, because otherwise injuries happen in every sport. That's why you and I have a job. But it's part of the preparation and part of taking your sport seriously that you need to do that prehab. You need to make sure you're looking after your body and putting it in the best possible place to not suffer an injury and not be sitting on the sideline.
For sure. And it's interesting, one of the things that I often have to remind patients of, because they look to these athletes and they look to the timelines that these athletes have when they recover. And they're like, oh, this guy came back in 4 months. He came back in this. And I think, so number one, you have to remember that guy is paid multi-million dollar. He has a multi-million-dollar contract to play that sport. That's his job. And when he's not doing that, his job is rehabilitation. That's what he does all day to get himself back on the field to do that thing, right? So number one, he has way more time. Number two, their motivation is way higher. And they're not going to be saying, oh, this hurts, I'm not going to do it, or I'm tired, I'm not going to do it, because all they keep thinking about is that contract or who's going to take their spot while they're out, right? And they are motivated to put in the work, to spend the time, to go and like do anything that is required to get back. So one of the things I'm always having to remind people of, yeah, I know Adrian Peterson came back in 4.5 months. That is not doctor recommended. You are not Adrian Peterson. You do not have the time or the money to invest to do that thing like Adrian Peterson. So we're going to do the Melbourne 2.0 rehabilitation program.
That's
like,
right. That's right.
That's what's going to happen.
Yeah. And I think like one of the most popular sort of tables that I put up all the time is I went back and collected the return to sport for ACL injuries in the NRL over the last at least 5 or 10 years. And it's really, it's great, but it's also unfortunate because all of those returns were from 6 to 9 months. Like there's not anyone who waited, more than 9 months to return. So then all of a sudden I've got people messaging me, being like, my physio told me that I won't be returning till at least 9 months. Is he wrong? Like, why is this happening? And so, as you say, having to sort of roll through that process of being like, this is why these guys are able to, come back. And the other thing, which I think is very, very important for people to understand, is when these guys get injured, they are the best athletes in the country. Like they are starting from a level where they are in the peak of their performance. They are training every day. So the base level that they're coming from is so much higher. So they are able to hit the ground running a lot quicker. But yeah, I certainly agree with you. It's probably the conversation I get caught in the most in terms of people messaging me being like, oh, I see that you said pec injuries come back in 10 to 14 weeks. I've just ruptured my pec and the surgeon told me I won't be back for 4 months. Why? Why can I see someone else? Is there somebody else who'll get me back in 10 to 14 weeks? And it's like, it's always an interesting conversation to have. That's for sure.
Yeah. And the other part of that is that, when those athletes come back, it's a risk benefit calculation, right?
Right.
The surgeons know they're coming back early. They know they're coming back early. They put in as much work as possible to make themselves ready. But the statistics show that when they come back, these guys are not coming back at 100%, right?
100%.
But they go, I'm at 93%, and it's good enough for me to play, and the risk for me to get re-injured is low enough. It's close enough to 100 that, I'm going to risk it, right? Like we saw this in the NBA finals. Kevin Durant came back from his calf strain, and then subsequently tore his Achilles, right? And people go, oh, well, why would he come back? And I'm like, listen, man, that dude had Achilles tendonitis, but when he had his calf strain, he had Achilles tendonitis, and they were trying to rehab it. They didn't want to talk about it too much, but they were trying to rehab that. He made a calculated decision. It's the playoffs, right? And he's like, what's the chance? And sometimes you gamble, sometimes you lose, right?
Yeah, and we had the perfect example of that just this weekend in the NRL. So our playoffs or our finals started this week, and one of the teams, the Parramatta Eels, one of their star players, really important players, he suffered a syndesmosis injury a month ago, required tightrope repair surgery. Now, look, if you look at the last couple of years, most guys have been coming back in 6 to 8 weeks, which is just crazy to me to start with. Like that's come down. Like even 2-3 seasons ago, we were talking about 10, 14 weeks, but these guys are all consistently 6 to 8 weeks. They're pushing the ladder, they're accelerating. Now, this guy, he was like, I want to come back in 5 weeks. I want to be a 5-week return to play after syndesmosis repair surgery, which at the time, I was like, oh my God. Now, it's the first week of the playoffs, right? It's a really, really important game. As you said, I think, and that was something I tried to sort of communicate to the fans during the week, is I'm like, look, even though he's coming back, this isn't like we're passing him 100% fit, and not only 100% fit, like in terms of no risk of re-injury, but it's also performance as well. He's not going to be at his top performance level, but it's that calculation of what's the risk of re-injury versus this is a playoffs game. We need to win it. And his name was Dylan Brown. Is Dylan Brown at, say, as you said, 93% fit? Is Dylan Brown at 93% fit better than whoever the substitution is at 100% fit? That's the calculation that they're making to sort of figure out, like what do we do in this situation? It's not just a cut and dried, oh yeah, we've got to 6 weeks, so now you can return to play because of this. It's always multifactorial. There's so many different, things that come into that risk versus reward decision. And he returned on the weekend, played really well, and didn't suffer an injury. So that's, fantastic. And he got through okay. They unfortunately lost the game, which was a bit of a bugger for them. But, once again, that risk versus reward calculation, it comes in and like 5 weeks is just crazy from a syndesmosis reflexory. That's,
For sure, that is crazy. Okay, so listen. Because Instagram only gives us an hour, so we're approaching the witching hour now. So final question, Brien. You're gonna teach us some stuff, my man. Okay, so the final question is this: if you had 5 things that you could tell let's narrow it down because you're an NRL analyst. So if there were 5 things that you could tell rugby athletes, anybody who's listening, to help to prepare themselves for competition and to help to avoid or prevent injury, and you want to give them 5 general tips, what would they be?
Let's go. So, I think the biggest one, and by far probably the thing that you see guys, and it's at any level, but particularly I'm sure it happens at the NRL level too. It's listen to your medical staff or your performance staff. They are the guys who are paid, who are the experts in the field. Be as compliant as you can with what they want you to do. And that's, as I said, it's at my level too. If we had 100% compliance with our patients in terms of what we needed them to do, we would be a lot more successful at our jobs. So number one. Number two, I think the most important thing to consider is load management as well. So making sure that you're not going, you're not spiking or you're not lapsing, going down into, a really low level of load. Try and keeping that load as consistent as possible, particularly when you're coming, off the preseason. I find that that's really, really important. Number 3, look, I think dynamic stability exercises is a huge thing. Like we talked about FIFA 11 and stuff like that. Like I feel like that's a sort of growing area of popularity that is particularly important. So trying to work on those dynamic stability exercises is really, really, really valuable to people of any level, but particularly at that high level in the NRL. In terms of injury and stuff like that, I think it's listen to your body is something that I always say. Don't ignore, and you see it so often. We saw a guy, it was either this season or last season, suffered a pec tear and came out in the media and was like, oh yeah, I felt a soreness in my pec the week before, but didn't say anything to anyone. Didn't say anything to anyone. And then went into the gym and was pumping out his chest press, and boom, pec went. That was like, yeah, it's tough to hear that, and I'm sure the medical staff at the team were quite disappointed, because it's something that can be managed quite well. If once again you listen to your body, I think that's really, really vital. Number 5. All right. Look. I think overall, making sure that you seek out the right person for, whatever you're going through. So don't listen to, your armchair critics, who say, oh no, you should be seeing this acupuncturist, or you should be seeing, this physio because he's doing this, or whatever. You find who you're comfortable with, who knows your body and knows what you're going through, and they're the people you should listen to.
Perfect. Oh my goodness, that's so good. I'm going to use all of those. So listen, Brien, I have to tell you, so this is number 16 in this podcast series, and this is definitely one of my top 3, man. This is one of my favorite. This was an amazing, amazing conversation. So we're going to wrap up. You have a few minutes, or a minute or two, I guess, to tell people where they can find you, and if they want to know more about you, they want to follow you and what you do. Please tell them how they can contact you, or at least see what it is that you do.
Yeah, so look, it's just NRL Physio, so NRL and then PHYSIO across all your platforms. So Instagram, Twitter, and Facebook. I'd say probably my most immediate feedback that I give for injuries is on Twitter, because it tends to be a lot more, a lot quicker over there. So if you want to know stuff quickly, definitely Twitter would be the place to be. But places like Instagram and Facebook give me a bit more time to sort of sit down and have conversations with different fans about, different injuries, stuff like that. I think where the value probably comes with a lot of my stuff is I do a lot of clear video analysis. So I edit stuff, I slow stuff down, I have arrows pointing, to different parts of the body. I explain why a player suffered a syndesmosis injury, how his foot twisted, what the player landing on his leg did, and stuff like that. So if you want to know more about why certain injuries occur, what's involved in the recovery process, particularly for rugby league and Australian sports fans, then give me a follow.
Perfect. And I would recommend that anybody who doesn't follow him now, please do that on Instagram and Twitter, because his breakdowns are amazing. And I'm always picking up stuff that I missed that he picked up. So please go follow this man. So I'm going to sign off, but Brien, please come back on the Zoom and I'll chat with you briefly there. And for everybody who was watching, thank you very much for watching. We greatly appreciate you supporting this project. And as always, that's been a word from Dr. Chris, not your everyday ortho.